Good morning, class. This lecture will be on all the major skeletal muscles. And as you read the chapter, you will see some muscles that I don't cover. Just to, for the sake of time, I want to be able to cover the major muscles. So uh, again, in lecture and in class, I'll be talking about the how muscles contract and all the things involved with that. And this is just going to go through the major muscle groups and where they originated in inserts, what is their action. Yeah, let's do it. All right, well, skeletal muscle. We know what it looks like microscopically. We're talking about how those filaments slide past each other. They only shorten. So when you look at a body, you see muscles that are the size is in proportion to the amount of power that you need, and you look at your limbs, what's going to move your shoulder and your hips, and humans have big glutes and big calves because that's kind of where our locomotion takes place as we run and walk. And this is obviously the effects of weight training here, right? No one's just ends up like this without a lot of hard work. So muscles will hypertrophy as you work them, as you stress them. They will react just like bones react to stress, and they will atrophy or get smaller with disuse. So even weeks and months, you have a loss of muscle mass. Yeah, taking a look, you can see we'll do. Looks like these all look familiar. Yeah, so looks like all of these we'll be covering. You can see obviously the difference in humans, the lower limb, the massiveness of the muscles for locomotion. And the upper limbs are large for climbing and carrying and punching and things like that. But your hamstrings and your quads and your calves are big for letting us run and carry loads. But we're going to start with the very strange muscles that nobody really works out at the gym. These are your facial muscles. And in cadaver lab, it's strange, and they're not as easy to look at than a biceps or a tricep, something like that, because the muscles they're from the facial bones, but they insert onto the skin, into the dermis of the skin to provide all of our expressions. And so it's a little messier. You cut the skin, and then you see the direction of the fibers, and once you take the skin off, you can see the different facial muscles, but it's not nice and clean because they're inserting not from bone to bone or across any kind of joint, but into the skin. And humans have naked faces, unless you got a beard. We're very naked here, and humans are so cued into facial expressions. So are domestic dogs too. It's interesting how dogs will look at us, even tilt their head, and they will look and they will sense any kind of emotions. They've just really tied into that. Yeah. And even when we do studies with great apes and doing experiments with them, we have to do a good experiment. You got to wear a facial shield or a bag over your head, because otherwise, if you know the answer, you're going to communicate that with your face, and this other primate is just cueing in on you. And so what I'm saying is that it's really hard to hide our emotions, because we are so cued into reading other people's faces to try to figure out deception and to figure out the emotions you're causing. And is it a smile? Is it a grimace? Yeah. So anyway, well, humans are very cued into facial expressions, this nonverbal communication. Yeah, and it's also pretty uniform across different cultures. I mean, it's a look of happiness or disgust is throughout culture. So it's definitely something that's built into us, even as we diverged. So I like that look. It's just normally the skin is nice, but this is a good look. I think it's the eyes there. But anyway, there's some muscles of facial expression you can take a look at, and we won't do them all, but we'll do some of the major ones here. And then you have muscles involved with chewing. So we'll talk about this masseter muscle, this temporalis, and this buccinator involved with chewing. But other muscles will be affecting for a smile, or affecting for a frown, or a look of concern, wrinkles on the forehead. Yes. So the first one, over the top of our head. So, oh, you lift up your eyebrows, right? Like that, you see you wrinkle the forehead, this look of surprise. Well, the muscle you have here is in front is called frontalis. How easy is that? It's your frontal bone. And then occipitalis, occipital bone. See, learning the skull bones comes in handy here. So these muscles just kind of peter out as they go above your scalp, and they turn into this aponeurosis. Remember, this like big flat tendon over your skull. And occipitalis back here is just going to kind of scrunch the skin in the back of your head, and the frontalis is going to raise your eyebrows and give you that surprise look. And some headaches are caused if you have a lot of tension there, push on some nerves there. Headaches have a lot of causes, but it's been thrown out as one too. So yeah, what do you think? This Epicranius, we'll call the whole thing with occipitalis and frontalis. And you can see here, it's going to raise your eyebrows. All right, we have a couple sphincter muscles. And sphincters are circular muscles, anal sphincter, pyloric sphincter, we'll talk about that. But here you have orbicularis oculi goes around your eyes. And so if you were to dissect under the skin, you would see muscle that goes in a circle around here. And so it's going to make you really squint, or with one, it's going to make you wink. So we call that orbicularis oculi, eye oculi. And then we have one around our lips called orbicularis oris, oral mouth. All right, so two circular muscles, orbicularis oculi, orbicularis oris, kissing muscle. All right, then we have a muscle here in our cheeks. It's right in there. So I got skin, I got buccinator muscle, and then in babies, they have big fat pads here too. They have these cute cheeks, but this buccinator muscle really allows us, you can see like in a trumpeter, you're going to be able to, it's going to be able to blow air out when you contract that. Used for suckling too. When we're getting milk from mom, our lips make a seal, and then we can use that to suckle. But that buccinator muscle here in your cheeks, especially when you're chewing, it's important too. As you have food in your mouth and you're chewing it over your molars, your tongue will move the food over your molars, and your buccinator will move it back. And so you kind of keep the food over those teeth, and so you can chew it. So buccinator working with your tongue will help work on the food. So buccinator. I hear buccinator sometimes. It just sounds like kind of like nails on a chalkboard. Buccinator I like, but feel free, call it what you want. A muscle called zygomaticus simply goes from your zygomatic bone down to the corners of your mouth for smiling. There is a major and a minor, but for us, we'll just call them zygomaticus. There's a big and a small one. So, yeah. And here's a weird one, platysma. And platy means flat. Platypus has like a flat beak. Yeah, think of like a plate, maybe, platysma, flat. But this muscle comes off of our chin, goes down our neck, and then it peters out over our clavicle into our chest, into the skin here. So it's in the skin, yeah. Wow. And some plastic surgery, people that have kind of waddly neck, they'll cut the platysma and sew it together to kind of tighten that up a little bit. Its action, it's gonna, well, like when you're shaving, it's gonna be skin, muscle in the skin that's gonna kind of tighten up. You can see in this guy here. It's gonna lower the jaw. Like we don't have all of our power is in the bite. We don't have a lot of power in, moving our chin out, but platysma will help a little bit with that. But yeah, it's a flat muscle here in our skin. And in most animals, we have muscle in our skin throughout. So like I said, a horse can move its skin on its butt to get rid of a fly or something like that. We don't have that, but what we have left besides our facial muscles is this platysma that comes down our neck. All right, and here's a handy chart. Yeah, so origin, insertion, that's pretty much where they go. And if you know origin, insertion of any muscle, you can tell its action. Just shorten it and see what happens, right? In this case, it's moving the skin on your face. And nerve, you don't have to know this. Facial nerve is your seventh cranial nerve that we'll get to in the next section, but it goes to all the facial muscles, this particular nerve out of your brain. Yeah, and actions. So there we go. All right, mastication or chewing. We have, see, I redacted a couple smaller minor ones, but the big ones I want you to know, make sure you know, is masseter. You feel it here in front of your ear. And then temporalis, you can feel it here. You see someone giving a speech and they're concentrating. You can sometimes see that temporalis kind of bulge out on their sides, on their temporal region. So it's on the temporal bone, temporalis, right? And masseter, mastication, chewing, big strong one. And look at this nice, beautiful model here. You can see that temporalis comes off your temporal bone and it goes underneath the zygomatic arch. And it will insert on a little pointy process off the mandible. And then you can see masseter is on the outside. It comes off the zygomatic arch and it's going to come on the outside of the mandible here. And you also notice the direction of the fibers is a little different. You can see temporalis coming this way and masseter going this way. So temporalis is also going to retract the jaw to bring it in. And you can see that masseter is going to protract the jaw or push it out a little bit because of that, the direction of the fibers. So it's a good example of looking at a muscle, looking at the directionality of the fibers and seeing if it were to contract, what would happen. And clearly both of these will cause you to close your jaws, but there's also that subtle secondary effect of protruding or retracting your jaw because of the angle. So you take a look, you can see again temporalis. And if you look on a plastic skull, not so much. A real skull, sometimes you'll see a line here. And then I showed you a wolf skull, something like that has that big crest on top of the skull. It would be a much bigger temporalis muscle. But in ours, it comes off the side of our big skulls and it goes underneath that zygomatic arch, which has been cut here, onto this pointy process of the mandible. Yeah, and then here you see masseter on the outside, right here. Yeah. Look at the redactions. Thank you. I mean, no, thank you. You're welcome. Yes. So a lot of small muscles along your back, deep in there, moving the vertebrae for posture, things like that. And a lot of small muscles in the back of your neck and the front of your neck too, really. So, but we don't have time to go through all the small muscles. That's a gross anatomy thing to get in there. But we'll talk about a couple major ones. Erector spinae is a whole group down your back along the vertebrae that are going to keep you standing erect like that. And then sternocleidomastoid, this big muscle that comes out in your neck when you turn your head. So sternocleidomastoid, you can see it just pops out when you turn your head. And I love it. Sternocleido means from your sternum and your clavicle onto the mastoid process, which you know, you feel that bump right here by your ear. So bam, you got it. And if you move just one of them, it's gonna turn your head to the side. Both of them will bring your head forward. Let's say you're doing a crunch, both of them will work like that. Yeah. And then this erector spinae, let's just call it that as a group. You can see there's a longissimus, iliocostalis, spinalis. You can learn all these and feel free to learn all these, but I won't test you on that. I'll call them all erector spinae for posture, for moving your spine. And we can do some flexion, extension, and rotation of our spine. And there's even little muscles that go just between the vertebrae there. So all kinds of complex muscles. If you pull back muscle, it's painful and lasts a long time. All right, let's just keep going. Let's look at muscles that move our pectoral girdle. So our clavicle and our scapula, and then obviously ones that move down to our arm and forearm. All right, so the ones that go onto our pectoral girdle, you can see here, I'm raising my scapula. I can bring it back, bring it forward. I can rotate my scapula. So a lot of movement I can feel in my pectoral girdle. And the big ones are your traps, your big trapezius muscles. And then we'll talk about serratus anterior as you put your hand forward to shake someone's hand. And then these I'll just talk really briefly in lab, but we don't even, I believe I took them off the list there, but some other smaller couple smaller muscles. Yeah, you can see. So I'll show them to you, but trapezius and serratus anterior will be what you see on the tests. So here's your traps. When I hear trapezius, I think back to geometry. I suppose, right? There's a trapezoid, right? They're damn close to being triangles when I look at it, right? You know what I mean? Yeah, but okay, but I'll agree. Maybe it's a trapezoid. And so the traps are a big complex muscle that have actions on your scapula that include elevating it and depressing it and retracting it and rotating it. Oh my God. So a lot of actions there. It's going to work on your scapula, right? We talked about when you reach up, when we talk about joints, how the scapula also has to rotate up. And so you can use one side of your traps or the other. You can use your upper traps, your lower traps, your middle traps to do all these kind of movements. But as you can see, when you look at the muscle, it's going to come off in the front of your clavicle and the spine of your scapula. It's attached onto your skull, occipital bone, and it comes all the way down for all the cervical, thoracic vertebrae like that. And so you imagine these middle fibers contracting here. It's going to retract your scapula, bring it back. And then you really work this when you do shrugs. You hold a lot of weight, you move it up. So this upper part of the scapula up here can be quite big in some people. The big shoulders here is gonna be raising your scapula. You imagine if you're holding some big weights, you're also raising that weight too. So here's your traps, right? People talk about your upper, lower, middle traps, but you can see where they're attached, and it's this big, like a kite-shaped muscle. They want to test if you have an issue with this. There's a nerve that goes to it. They can have you do shrugs, and if you have an issue, you won't be able to very powerfully do that. Yeah, you can see some people working their different parts of their traps. All right, and underneath, just real quickly, you have these rhomboids that are going to retract your scapula and raise it and rotate it a bit. And there's a muscle called levator scapulae. It simply goes from the corner of the scapula up to your neck. It's going to just elevate your scapula too. These are relatively minor compared to your traps. All right, this is a difficult muscle. Serratus anterior to kind of understand, I guess, its origination, its insertion, where it is. So just bear with me, try to pay attention here. You'll see that it's going to insert here on your ribs. It's going on your ribs here. And it's serrated like a knife, a serrated knife. So I'll show you a picture of someone that's low body fat, big muscles. You can see the serrations coming on the ribs here. So you see it coming off the ribs. And then it goes back and it goes on the medial board of the scapula, underneath the scapula. You see that? So in the gross anatomy, if you put your hand here in the front, you can put your hand under there and you can feel the subscapularis there underneath it, and you can feel the serratus anterior. If you put your hand this way, if you were to cut out the rhomboids, put it this way, you would get underneath serratus. Right there. So can you see where it comes off the underside of the scapula along the medial border? Yeah, and then it comes forward onto your chest where it inserts onto the ribs like that. And so I want you to imagine the action of serratus anterior. Think about it. Imagine that shortening. What's going to happen? Yeah, it's going to put your scapula, it's going to put it forward. Let's say you're reaching out to punch someone or just shake someone's hand. It's going to move the scapula forward on your chest, as if you're reaching forward. Yeah. Whereas the traps will retract your scapula. It's going to move the scapula forward, the opposite direction. Yeah. So important in punching or shaking hands, vigorously shaking hands, a politician maybe. Not these days, of course. All right. And then I'll show you someone's serratus anterior. So yeah, you can see it looks like a serrated steak knife, something like that. All right, serratus anterior. All right, let's see. Muscles of the arm. Yeah, let's do it. You can see I've removed a couple. Pec minor, I just got to remove that. And then one of the teres major, I happen to know, would be under there too. But these are the big ones. Your pecs, your big chest muscles here, your pecs, right? And then your back is your lats. Your lats, we're doing lat pull downs like this, big flat muscles on your back. And then your deltoid makes up your shoulder. This nice rounded part of your shoulder is your deltoid. And then through these are 3 muscles that are around your scapula for, they call the rotator cuff muscles. And there's one more too. That's going to kind of stabilize your shoulder joint and rotate the humerus. All right, let's talk about it. Let's talk about pec major. Big one in your chest. Although I say that, but in cadaver lab, we dissect, elderly people. It's pretty much thin as like cardboard, really. But in some of you, it's a big, thick muscle here, your pecs, right? And your pecs come off of your ribs and your clavicle. Sometimes we even talk about different parts of it, clavicular and sternal parts of it. But oh yeah, right here, sternal, yeah. And it comes off your chest and inserts onto your humerus, your arm bone. You can see here. And so when you're gonna work that out, you might work this machine that brings it in like this, or just doing military press kind of thing. So it's going to flex, bring your arm flex, adduct, and also rotates the humerus, immediately rotates. So yeah, lifting those weights ahead of you, and that's gonna make the pecs get bigger. Yeah, you got a pec minor underneath it. You can see it's off the ribs onto your coracoid process, pretty minor. Yep, so your big pecs, pec major. And the opposite, if you were to hold your humerus steady and work your pec major, it would lift your chest. See what I mean? Normally your chest is the stable part and you're moving your humerus. But you can also hold your humerus steady and it will help you with like really deep breathing if you needed it. Yeah, so bring your arms in, together, and it'll rotate it too. And here's your lats, latissimus dorsi. And latissimus, it means the broad muscle of your back. Latissimus is big, broad muscle. And you can see by this picture, damn, that's a big muscle, but it's real thin here. It's real thin where it comes off, originates off this aponeurosis in your lower back, this big tendon, kind of flat tendon, and off your ilium and your sacrum, this big tendon. And it gets thicker as it gets towards your armpit. It gets thicker and thicker towards your axilla, your armpit. And then it's pretty thick in your armpit. And then it's going to attach, you can see, onto your humerus. And so lat pull down machine, you're pulling down. So this is important in rowing and in swimming. It's going to adduct your arm and it's going to extend your arm, right? So it's going to bring it down like this, okay? So your pecs moving this way, your lats bringing it down like this. And gives you that kind of swimmer's profile where it's kind of V-shaped, because if the lats are big in your armpit, and then it comes down to a narrower waist. Yep, but big flat muscle in your back, and it comes up onto your humerus to bring your humerus down with force if you're doing pull-ups. And then deltoid. So deltoid is over your shoulders. Right here. It's a powerful muscle because you have the weight is going to be, imagine that you're doing these, you're lifting or to the side, you're doing that. And the weight is way the hell out there and the fulcrum is way over here. And so it's inserted, back here in your humerus. Remember that deltoid tuberosity, about a third of the way down your humerus. So there's a lot of power in your delts. You know how hard it is to hold up. Try to hold up a stack of books. See how long you can hold it. So a real powerful muscle, deltoid over your shoulders. And for those of you bodybuilders, you can work out, you have your front delts and your rear delts and your mid delts. So you can do different kind of raises to work those. And you can see that here. And so it's going to be a powerful abductor of your arm, right? Raising your arm up. And if you're carrying heavy suitcases, it's going to prevent that downward dislocation, right? Yeah. And then, here's the deltoid here. And finally, rotator cuff muscles. And I believe in lab, I call them rotator cuff. And I don't think I separate them out, but it's really pretty simple. And you guys can get it just in a second here. Here's the spine of the scapula in the back. We call this infraspinatus muscle, supraspinatus muscle above it. And on the underside, really it's the anterior part, is subscapularis. It's just subscapularis, it's under the scapula. So these 3 muscles along with this is teres minor, this other muscle, you can learn just like that. right? So supraspinatus, infraspinatus, subscapularis, a rotator cuff. So they're going to rotate your humerus. And the supraspinatus we're going to see is important for abducting too. You can see it coming on the very top there. It actually begins abduction. And so people that have supraspinatus being paralyzed or have an issue with it, they can't abduct their arm. Well, sure, the deltoid only works after like the first 15 degrees, then it's powerful. But supraspinatus is necessary to start that abduction. So people, if you have this problem, you lean until your arm falls and then deltoid can take over. So it's strange. So supraspinatus begins abduction of your arm, and then the deltoid is the power that really moves it up. So yeah, rotator cuff, and causes a lot of issues in pitching, and I imagine all the involvement in how strong you're just taking all the muscles and causing it to rotate your humerus and extend it rapidly. It can cause pulls, muscle pulls, bursitis, problems in the shoulder. All right. Yes, we'll finish the arm here. You guys can pause it if you want, right? I feel like when do I want to break this up into pieces? But I think I'll just keep going here. Let's look at our arms, right? Our guns, right? With the guns. And you think guns, you think biceps. And you need to say brachii. Brachii means arm, because if you say I'm working my biceps, you have a biceps femoris in your hamstring. So you could be doing leg curls. So we say biceps brachii to mean the two-headed muscle in our arm. So brachii means arm. And speaking of, brachialis means arm muscle, just arm, right? And that's going to be a powerful flexor of your elbow along with biceps. And then brachioradialis goes from your arm to your radius, right? Simple, simple. And then triceps brachii has 3 heads, and that's the sole muscle in the back of your arm for extending your elbow. So your biceps, your guns, and they get a lot of accolades, you know, in the weightlifting world, because you have this bulge right there, right? You can work that out. But we'll see that there's a muscle underneath it called brachialis, which is really takes a lot of the heavy lifting, if you will, when you flex your elbow. But biceps in fact has 2 heads. It's got a short head here in the coracoid process. The long head goes through that groove and it goes right into the shoulder joint, attaches onto the scapula. So biceps crosses 2 joints. It's going to cross the shoulder and the elbow joint. So whenever muscles cross 2 joints, like the hamstrings, it's more complex. It has more actions. If like brachialis just simply crosses the elbow joint, it's simple. It's going to have its actions are going to be simpler. Biceps, as you can see, it's a fusiform or has a big belly in the middle and attaches onto your radial tuberosity on the radius. Now, your radius is not a very stable place to plant your muscle, is it? Because the radius rotates, right? So when you work your biceps, when you do curls, you're doing curls, it turns out biceps does not work when you do a reverse curl like this. Because now if your hand is pronated, not supinated, that biceps the tendon is twisted around because that radius is rotated. So when you do a curl, you'll find yourself supinating if you're using your biceps. So biceps is not only a flexor of the elbow, it's a powerful supinator. And why would you need power? Like what kind of actions in everyday life where you need to supinate? Like I want a bowl of soup. I mean, it doesn't have to be very powerful. Guys, think about it. If you're right-handed. Yeah, working a screwdriver or turning a doorknob. So working that screwdriver, I use the one on the drill, but if you're doing the old-fashioned screwdriver, you start burning, your biceps start burning because that's powerful supination. And that's one of your powerful supinators is that biceps. All right, you guys all understand why it's flexes the elbow and it supinates? Is it because it's on the radius and it's gonna cause the radius to become in that anatomical position. All right, underneath biceps is brachialis, which means arm muscle. And this it comes just off the humerus and it goes onto the ulna. which is the stable one. So the brachialis is going to flex your elbow in any position. It don't care if you're doing reverse curls, normal curls. Brachialis is always there for you. You can see it here beneath the more famous ball of your biceps there. All right, we got one more here. So we've talked about biceps and brachialis flexing your elbow. There's one more. This is the weakest one. I believe brachialis is your strongest pure one, and then biceps, and then brachialis is your weakest flexor of your elbow. And it comes off your arm, and it goes onto your radius. So it doesn't cross your wrist. It stops here on your radius right here. And so this is going to flex, but in particular, because of its where it attaches on your radius, it kind of makes you sometimes called the beer drinking or soda drinking, depends, muscle, because it brings your hand in this middle position, not supinated, not pronated, but the middle position, and it brings it up to your mouth. I mean, it's going to flex it like that, yeah. So brachioradialis. And this, guys, you can see, you can even work that one out pretty well, kind of doing this hammer curl, right? All right, the back of your arm, one muscle, the triceps brachii, and it has 3 heads. And you can see it inserts here onto the olecranon. So it's going to come off your humerus and your scapula and insert on your olecranon. Yeah, that's purely going to extend your elbow. I say purely. You can see it does cross the shoulder joint, so it's going to have some movement at the shoulder too. The 3 heads, you got a long and a medial and a lateral head. Yeah, but they're all, you can see, coming off, attaching onto that olecranon for powerful extension of your elbow. So it's an antagonist muscle to the biceps and the brachialis. Yeah, looking at your arm, you can see back here, the bone there is your humerus, and back there, that's your triceps. And then you have your biceps, and then underneath it is that brachialis. Beautiful. Your forearm, my God, it's a lot of muscles in your forearm. Luckily for you, we're just going to break it down into just call them extensors and flexors. And if you take a look at this picture, you can see, looking at your radius and ulna there, look where the power is. Your flexors, look at all the muscles in your flexors. Your extensors are just a few muscles on the back. Well, there's quite a few, but your power is in the flexing of your fingers and your wrist, not extending, like this. Your power is the flexing, give you that grip, right? In fact, when you get electrocuted, you often holding on to something metal, right? A fence or wire or something like that. You can't let go because all the muscles in your arm are being stimulated, but your flexors are so much stronger than your extensors that you just grip. Yeah, so we're just going to go with that. Your flexors, you feel the front of your forearm. Oh, man, just thick muscle there. There's several layers of flexors for your fingers. Cool stuff. I mean, see these tendons here? This one here in the middle is called palmaris longus. That's missing in 13% of you. So that's so cool too. We can look at that lab if you want to see if you have one. But all these tendons, we'll talk about how they go through this carpal tunnel. But these are all the flexors, and the extensors will be the back of your arm, back here. And so look, you can take a look. And again, you guys, maybe some of you have learned these in anatomy. Maybe you plan on learning them. Maybe you're like, I want to learn them. Go ahead, feel free. And I'm happy to help you. I taught all of them in gross anatomy. And all of these flexors go through what's called a carpal tunnel. And you've seen it when you look at the bones, but in here, there's a really tough ligament going across it. And all these tendons for flexing my fingers and my wrist go through this tunnel along with a nerve, this median nerve. And that's the issue. If you overuse, you're typing all day in the wrong position, you're a meat cutter, repetitive hand motions will cause these tendons to be inflamed, and it presses on that nerve and causes tremendous pain. So carpal tunnel, especially in meat cutters or office workers that are always using their fingers, they'll have to do carpal tunnel surgery. My stepbrother had that. Open it up like that. Your extensors on the back, obviously you can see these tendons in the back of your hand. You can extend your fingers, extend your wrist, right? You can get a tennis elbow if you, a lot of racket sports, you'll forcefully, use your extensors, right? Yeah, but they're clearly, the muscle mass of your extensors is much less than your flexors. That's where you have your power. All right. Yes, here we are, the muscles of the abs. Yeah, I'll go ahead and take a break. I just feel like I need to, all right? So we'll go ahead. I will make a part 2 to this. So I could go on, but I think there's just a break is necessary. So, all right, we got most of the muscles done, from facial expression to the muscles that move our shoulders, to the muscles that move. This is our arm and forearm, right? Tune to that. And now we'll move to our abs and then our lower limbs. All right, lots of muscles, a lot of memorization of these muscles, but hopefully some are very familiar to you. And if you know where they are, you can figure out their actions pretty easily. Just think about it. If you know where things are, imagine it contracting and then what's going to happen. All right.